Hey, it's Danielle from Black Business Boom in Black Owned Nashville, and we are live with my dentist, who is a Black woman here in the Nashville area, Dr. Garrison-Jeter of Definition Dental. How are you?
I'm good. How are you?
I am fantastic. I can't complain at all. I'm excited about these tips though,
Oh,
because
yeah.
especially I know there's some business owners that are going to tune in that really need these tips because we always are like, do we need to pay for the dental insurance? Do we not? And so you're going to give us some ways that if we don't pay for the dental insurance, that we can still maintain our oral health. So
Yeah.
let's jump on in here. What tips do you have for us today, Doctor?
So first off, people think that just because they don't have dental insurance, that means they can't receive dental care. A lot of everyday people still go to the dentist on their regular 6 month checkups without dental insurance. So if you're a person who keeps up on your mouth, doing regular home care, and you just need preventative services, sometimes it's actually not even worth it to purchase dental insurance because you're paying, 30 to $40 a month for your insurance, and then times 12 months, and then you're only getting the cleaning. Well, you could get your exam, x-ray, and cleaning for less than that.
Yeah.
So that's one thing, that's a myth that's out there, that you actually have to have dental insurance. You don't. Now, if you're a person who does not, take care of their teeth at home, and you have lots of issues that need to be addressed, then you probably will want to look into getting some type of dental insurance to kind of separate the cost, so that you don't have to pay all of it up front. Secondly, dental insurance is not, it's not a free thing. It's kind of like a coupon. So they only have a maximum amount that they'll pay for you towards a year anyway. So once you meet that maximum, typically a maximum is 1,500, 2,000, 3,000 if you got a really, really good plan. But once the insurance company has paid that amount for the year, they're not going to pay anymore. So that's two
Mhm.
crowns, so it just depends on, your habits at home, and what you're looking for. But
Okay.
you gotta do your part at home.
Okay. So I know that we all should know this, and we all, especially as grown adults, we should know things that we should be doing at home to help us to help prevent having to have any major issues, but it happens. But either way, remind us for those that may have forgotten or maybe haven't gone to a dentist in quite a while, what are some preventative things we should be doing at home?
Okay. So first off, we have to, not as dentists, not bash and get down on our patients, because a lot of times people don't really know what to do. And that's why you need to come to us so that we can help you and educate you on what to do. To be honest, I did not know how to properly floss until I got to dental school. Okay. So people, don't get down on yourself. That's what we're here for, to educate. Okay. So first off, for the kiddos, like I just had my second kid 5 months ago. Some people don't know that you actually have to do oral care for your infant, for your child. So even though a baby may not have teeth yet, you still want to go ahead and start wiping their mouth out with a
Mm.
clean washcloth, a wet one. So you'll wash your hands, and you'll get a clean washcloth and wet it, put it around your finger, and on a daily basis or every couple of days, when you give your baby a bath, you'll just kind of wipe out and scrub their gums with the wet cloth. They also make little toothbrushes that you can put on your finger to rub around in their gums and on their tongue to get that white layer from the milk
Mm.
off of their tongue. This is a good thing to do for your infant because it gets them in the routine of having something in their mouth, cleaning their mouth, so that when they're a toddler, you're not having to do the headlock and brush, technique, because they don't want to have their teeth brushed. So that's a good thing to start with your kids early, and having your kids see you engaging in oral care as well. So just for the basics, brushing 2 times a day, flossing, and using a fluoride rinse. Okay. Your home care is your first line of defense against plaque buildup, decay, and gum disease. Okay. You see yourself every day. The dentist sees you maybe 2 times out of the year. So your first line of defense is your oral care at home. Okay. The reason why we want you to use a mouth rinse with fluoride in it is so that you can make your enamel strong. Okay. You don't want to use a mouth rinse that has alcohol in it because alcohol dries out your mouth. Okay. And anytime that your mouth is dry, that's an environment that's more prone to having cavities. Okay. So a fluoridated mouth rinse that is alcohol free. Okay. Flossing. A lot of people say I have a water pick, so I don't have to floss. Negative. Okay.
Lord Jesus, I thought I was doing something over here with this.
No, wait. So water flossing is better than doing nothing, but it's not the only thing that you should do. But it's great for people who have lots of like implants, bridges, or braces. It's a good adjunctive tool to help clean out those areas. Or if you have patients who are elderly and their manual dexterity is not as good, so they can't get in there and floss, it's good for them. Or if you've got dementia, like you're caring for a parent that has dementia, but you still need to upkeep their mouth, that's easier to use and palatable for them. Okay. Other ways that we can take care of our mouth is making wise food and drink choices. Okay. So foods that are high in sugar and simple carbs, they provide nutrients for decay causing bacteria. So if you're eating lots of, drinking sodas and lots of candies, lots of high carb, simple carb foods, that makes the environment, the bacteria, we get fever, hungry, we're going to eat this. They let out acid that causes cavities in your mouth. So eat a lot of fast food, a lot of simple sugars, simple things like that tend to be more prone to having cavities. So you want to choose things that are like fibrous fruits and vegetables because they are a natural brush for your teeth. So like carrots and things like that, broccoli, when you chew them and it's nice and fibrous, it's washing away or removing things from your teeth as well.
That is good to know. And y'all, I went to see Dr. Garrison-Jeter a few weeks ago, and I got cavities, and I'm like, I don't even eat no sugar. Like, I'm literally over here, like, I don't even eat candy. And so all my life, I was thinking, if you don't eat candy, you shouldn't have. But I drink smoothies every day.
Yeah, so we're going to
that was one thing that she told me. She was like, well, you're eating, you're drinking these smoothies every day. And so tell them what you told me to do that can help with that when I'm having these smoothies every day.
Okay, so I want you guys to eat fruits, and that's great. But a lot of fruits are acidic in nature. And so what makes the environment more prone to cavities is that the pH in your mouth is low. So eating smoothies and things like that makes the pH in your mouth low. So what you can do is, if you're going to have a smoothie, don't sip on it all day. Because if you sip on it all day, your mouth is acidic all day. That's first off. Secondly, if you're going to have it, when you get done having your smoothie, swish your mouth out with water afterwards so that you can get your pH in your mouth back to a neutral pH.
Okay, and I'm just over here sipping on my little smoothie, not doing nothing, thinking that I'm doing the best thing and causing harm. And so it just all demonstrates how important it is for us to actually go to a dentist, right?
Because so you can learn these things.
Yeah, a lot of times you just think that you're doing the right thing, and you recognize by going to a professional that you may not be doing the right thing for yourself and actually doing yourself harm in another way, right? So I'm over here trying to like be healthy and get in my fruits and vegetables with this smoothie, but then I'm messing up my teeth. So it's just so important for us to talk about how do we prevent things, especially in our community, and not be so reactive when we can be proactive about our health. And our oral health is important because it can truly lead to other conditions that can really be harmful for our entire body. So that's why I'm super happy to have you as my dentist, but also as an industry expert in educating our community, because a lot of these things we just don't know.
Right. And prevention is cheaper than having to deal with the effects of not taking care of things. The more you neglect, the more expensive things get.
I'm telling you, so that's the number one tip
Right.
about your oral health on a budget is if you keep it right, you won't have to fix it. And
Yeah.
so I love that. So if someone is like, hey, I mean, I'm gonna just put it out there. I didn't get dental insurance. I got me a healthcare plan, didn't get the dental insurance, but I mean, when I came in for my exam and my cleaning, it was like $200, so it was not anything that was like ridiculous. And even for the cavities, it's another $200, so it's important for us to understand that just because you don't have the insurance doesn't mean you cannot go see somebody.
Exactly.
It may be in your budget, and then there are other payment options like care credit and things like that can help you and break those payments up over time as
Yeah, Care
well.
Credit, Scratch Pay, Lending Club. There's different things out there that you can use at the dental office. You can use them at the medical office. So it's not like you have to get one type of financing and you can only use it in one place and then have to get a different financing for something else. So say if you apply for Care Credit and you get a $5,000 limit for Care Credit, you can use that at your dental office. You can use it at your medical facility,
You
wherever.
can use it at your vet office.
The
So I can
vet
use
office,
mine to pay for
chiropractor.
Berkeley to get stuff done. So
Yeah.
yeah, I love it. Well, this was very informative. Sometimes we just take for granted that people understand all of these things they should be doing. When again, some of us may not have been to the dentist in a while. Our dentists may not have thought to tell us because they think that we know. So I
Yeah.
think it's just important for us to just talk about, sometimes take it to the basics, to give folks the basics of what they should be doing. So I greatly appreciate you joining us today, giving us some tips, and we'll be back next month with even more. And tell everyone before we wrap up, how can they find you if they're interested in booking an appointment or learning more? What's the best way for them to find you?
We're on Instagram, www.instagram.com/Definition Dental Studio, or Definition Dental Studio is our handle. You can go to the website, www.definitiondentalstudio.com, and you can book your appointments online for new patient visits.
I love it. Thank you so much for joining us. Y'all, make sure you're out there keeping up with your oral health, keeping your teeth together, taking care of your mouth, and then taking care of your babies and making
Yes.
sure that you're doing those things as well. I tell you, I don't have no kids, but if I had one, I wouldn't have known that I was supposed to do that. So extremely helpful. Thank you so much for joining us. Have a wonderful day, and